Epidemiology and prevention of hypertension. Definition: hypertension is a condition in which the blood vessels have persistent raised pressure. The stages of hypertension: it can be of two stages. If stage 1 is 140 to 159 systolic, stage 2 is greater than 160 systolic. Classification: it can be of two types, primary or essential, and secondary. Primary hypertension has no identifiable causes. Secondary hypertension causes are chronic renal disease, renovascular diseases, hyperthyroidism, Cushing's disease, pheochromocytoma, and etc. Why is hypertension of public health importance? Because of its morbidity, mortality, and disability. In India, the prevalence of hypertension is 25.4%. Hypertension accounts for 7% disease burden. There are various risk factors for hypertension. They are modifiable and non-modifiable. Modifiable risk factors is of two types, metabolic and behavioral. Non-modifiable is due to socioeconomic status, urbanization, and aging. Clinical features: mostly asymptomatic, sometimes shortness of breath, chest pain and palpitation. Headache is prominent in occipital region. Dizziness is associated with postural hypertension in elderly people, and in some cases family history is also present. Complications are aneurysm, chronic renal disease, retinopathy, heart failure, and stroke. These complications are due to uncontrolled cases. Management and prevention: there can be of 4 steps. It is primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Primordial prevention decreases the appearance of risk factor. Primordial prevention can be of two types: broad strategies and at home. Broad strategies include strict government policies and regulations enforcing manufacturers to produce healthier food. So at home, do not add salt during preparation of food and choose products with low salt content. Then comes the primary prevention. It is nothing but health promotion and specific protection. Health promotion is through health education regarding symptoms of hypertension, and specific protection is towards the dietary approach to stop hypertension, like eating vegetables and fruits and whole grains, in eating food rich in proteins, minerals and fibers, and eating food with less unsaturated and trans fat. So these are the foods that should be taken to reduce the risk of hypertension. They are grains, vegetables, fruits, and low sodium and low sweets, and nuts, dry seeds, beans and peas can be eaten. Then comes the secondary prevention. It can be done through screening and routine laboratory test. Screening includes BP measurement, BMI, waist circumference, and hearing for Brute. Routine laboratory tests like ECG, analysis of urine, blood sugar testing, blood urea, serum creatinine, and fasting lipid profile can be done. The treatment is giving calcium channel blockers like amlodipine and beta blockers like propranolol, metoprolol, nebivolol, and ACE inhibitors like enalapril, ramipril, and angiotensin receptor blockers like losartan, and diuretics like thiazides and potassium sparing diuretics and loop diuretics, and vasodilators like terazosin, and centrally acting agents like clonidine can be given to treat the hypertension. Then comes the tertiary prevention. Tertiary prevention can be done through preventing the complications like retinopathy, hypotensive nephropathy, stroke. And in an event of stroke, rehabilitation measures need to be taken. Then comes the surveillance in hypertension. WHO steps approaches include information on behavior, information on physical measurements, and information of biochemical test. Stage 1, population based risk factor assessment. An annual population based house to house survey among individuals greater than 30 years will be done to find at risk individuals and those already on treatment, etc. And then comes the stage 2, that is referral. At risk will be referred to PHCs for lab investigations in consultation with the treating doctors at the facility. referred. NPCDCs, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke. So, the cancer control program is launched in 1980s. It only focused primarily on increasing access to cancer treatment. But after that, India has launched its comprehensive NPCDCs in 2010. So, the key strategies of NPCDCs are health promotion through behavioral change communication, outreach camps, facilities for diagnosis and treatment of NCDs at all levels of care, setting of NCD clinics, capacity building, development of databases, and surveillance system. I hope you enjoy this video and thank you.